Have you ever looked in the mirror and noticed a bright red spot in your eye? While alarming, this is usually a harmless condition known as subconjunctival hemorrhage. It occurs when a tiny blood vessel breaks just beneath the conjunctiva, the clear membrane that covers the white part of your eye. The conjunctiva is filled with tiny blood vessels that can rupture easily. When this happens, blood gets trapped under the conjunctiva, creating the appearance of a red spot. Rest assured, this condition typically doesn't affect your vision or cause pain. Subconjunctival hemorrhage is very common and can affect people of all ages. It often appears suddenly without any warning signs. While it can look alarming, it's important to remember that this condition is usually harmless and resolves on its own within a week or two. If you experience any discomfort, such as a feeling of scratchiness in your eye, over-the-counter lubricating eye drops can help. If you have any concerns, it's always best to consult with your doctor to rule out any other underlying conditions. Subconjunctival hemorrhage often occurs without a specific identifiable cause. However, there are several factors that can increase your risk. These include straining. Simple actions like coughing, sneezing, or even straining during a bowel movement can cause a sudden increase in pressure in your blood vessels, leading to a rupture. Trauma. A minor injury to the eye, such as rubbing your eye too hard or getting poked in the eye, can also cause a blood vessel to break. High blood pressure. While not always a direct cause, uncontrolled high blood pressure can make you more susceptible to subconjunctival hemorrhage. Blood thinners. Medications like aspirin or warfarin can thin the blood, making it easier to bleed. This can increase the likelihood of a subconjunctival hemorrhage. In rare cases, subconjunctival hemorrhage can be a sign of an underlying medical condition, such as a bleeding disorder or an eye infection. If you experience recurrent episodes or have other symptoms like pain or vision changes, it's important to seek medical attention. The most noticeable symptom of subconjunctival hemorrhage is the bright red spot in the white part of the eye. It often appears suddenly and can vary in size from a small dot to covering a large portion of the sclera, the white of the eye. While the red spot can look alarming, subconjunctival hemorrhage is usually painless and doesn't affect vision. However, some people may experience mild discomfort, such as a feeling of scratchiness or a foreign body sensation in the affected eye. It's important to distinguish subconjunctival hemorrhage from other more serious eye conditions. If you experience any of the following symptoms, seek immediate medical attention: pain in the eye, blurred vision, sensitivity to light, discharge from the eye, double vision. Section 4. Treatment and management. What to expect when you see your doctor. Most cases of subconjunctival hemorrhage resolve on their own without any specific treatment. The blood under the conjunctiva will be reabsorbed by the body, similar to how a bruise fades away. This typically takes about 1 to 2 weeks. During your visit, your doctor will examine your eye to confirm the diagnosis and rule out any other conditions. They may ask about your medical history, any medications you're taking, and any recent trauma to the eye. While no specific treatment is usually needed, your doctor may recommend using artificial tears to alleviate any discomfort. Over-the-counter pain relievers such as acetaminophen or ibuprofen can also help reduce any pain or inflammation. Section 5. Prevention and outlook, reducing the risk and understanding the prognosis. While it's not always possible to prevent subconjunctival hemorrhage, there are steps you can take to reduce your risk. Control your blood pressure. If you have high blood pressure, work with your doctor to manage it effectively. Protect your eyes. Wear protective eyewear during sports or activities that could potentially injure your eyes. Avoid rubbing your eyes. Rubbing your eyes can irritate them and increase the risk of blood vessel rupture. Manage coughing and sneezing. If you have a cold or allergies, take steps to manage your symptoms and avoid excessive coughing or sneezing. The prognosis for subconjunctival hemorrhage is generally excellent. It is a harmless condition that typically resolves on its own within a week or two, leaving no lasting damage to the eye or vision. However, if you experience recurrent episodes or any unusual symptoms, it's essential to consult with your doctor.